Welcome to Mental Health Matters, a compelling series brought to you by Ontario Shore's Centre for Mental Health Sciences. Every week, we share stories of hope, recovery, and resilience, accompanied by expert advice and resources to help navigate and understand the complexities of mental health. Situated on the shores of Lake Ontario, Ontario Shores is a dedicated public teaching hospital. We provide specialized assessment and treatment services for those living with complex and serious mental illness. Our unwavering commitment to exceptional patient care is built on safe and evidence-based approaches, ensuring successful outcomes through clinical best practices and cutting-edge research. From adolescents to geriatrics, our recovery-oriented environment fosters discovery, recovery, and hope. Mental Health Matters is an opportunity for all of us to learn, grow, and support each other on this journey of well-being. Each episode focuses on breaking down the stigma surrounding mental health through crucial conversations and fostering empathy within families, schools, workplaces, and communities. Join us as we embark on an exploration of the topic of mental health. Together, we make a difference.
Welcome to Mental Health Matters. I'm your host, Julie Van Hardingsveld. In this episode, we're diving into the heart of transformative change, and I'm thrilled to guide you through this journey. In this special segment, I have the privilege of introducing you to two people at the forefront of steering mental health care toward a brighter horizon. Karim Mamdani, President and CEO, and Dr. Phil Klassen, Vice President of Medical Services at Ontario Shores. So, come along with me as we engage in a thought-provoking discussion about the future of mental health care at Ontario Shores, with a special focus on the plans to introduce Psychiatric Emergency Services.
Hello, my name is Karim Mamdani, and I'm the President and CEO of Ontario Shores Centre for Mental Health Sciences. We are a public teaching hospital that offers a variety of specialized assessment and treatment services to people living with complex and serious mental illness. Since before the turn of the last century, our primary hospital site has been situated in Whitby on the scenic shores of Lake Ontario. With 340 beds, over 90,000 annual outpatient visits, and over 1,300 staff members, we are one of 4 Ontario mental health hospitals and are pleased to serve patients from Toronto, Durham, York, Halton, Peel, and Kawartha Lakes. Our patients receive exceptional care that is delivered using safe and evidence-based approaches to achieve successful outcomes using the best clinical practices and the most recent advances in research. Our patients benefit from a recovery-oriented environment based on compassion, inspiration, and hope. We serve 5 deep subspecialty populations ranging from adolescents to geriatrics and provide court-ordered assessment and treatment in forensic mental health. Although we are humble, it's important to highlight a few notable accomplishments. We are accredited by Accreditation Canada with exemplary standing, the highest level possible. In addition to receiving Excellence Canada's Order of Excellence for the Mental Health at Work framework, and named for the 7th consecutive year one of GTA's top employers. For our fully electronic medical record system, which we use to support key decision-making for increased quality of care and patient safety, we were the first hospital in Canada and the first mental health hospital in the world to receive the prestigious Healthcare Information and Management Systems Society Electronic Medical Record Adoption Model Stage 7 Award. Despite our important work, the province's demand for mental health services is at an all-time high. Bringing emergency psychiatric services to Ontario Shores, we believe, will help to ensure that people have access to appropriate emergency mental health services as part of the solution to Ontario's mental health crisis. Ontario Shores does not currently have an emergency room. We are seeking government approval for a capital planning grant in order to bring psychiatric emergency services to Ontario shores and build an emergency psychiatric assessment treatment and healing unit, or empath for short. To learn more about the psychiatric assessment treatment and healing model, its advantages, and why it's so desperately needed, I'd like to introduce you to Dr. Phil Klassen, Vice President of Medical Services at Ontario Shores.
Thank you, Karim. As a specialized mental health hospital, implementing the empath model is one of the most effective ways for us to contribute to addressing our province's emergent mental health challenges. Our population is growing, but beyond more than population growth, the demand for psychiatric emergency services in Ontario is increasing rapidly. Traditional emergency rooms face issues like overcrowding, lack of resources, and staff who may not have received training in mental health care or be comfortable providing care to a patient experiencing a psychiatric emergency. As we know, patients in Ontario spend an average of 21 hours in an emergency department before being admitted. What's more, in terms of patient care, the noise and activity in an emergency department can be stressful for people experiencing a mental health crisis. The empath model distinguishes itself by providing immediate psychiatric assessment and treatment, both psychological and pharmacological, in a unique space. A space that's open, calming, reduces agitation, employs recliners rather than defined rooms, and fosters a sense of community in a large emergency area, allowing for dignity and confidentiality, and also providing for surge capacity. There are significant benefits for both patient care and the economy. We know that with prompt intervention, many psychiatric emergencies can be resolved in less than 24 hours. Mental health expertise, a specialized environment, and rapid assessments all contribute to a better patient care experience. Patients who receive treatment at empath at Ontario Shores can then be referred to our outpatient clinic for follow-up care. And patients who don't require the level of care provided by empath can also go to the outpatient service. This model could save $1.1 million by reducing pressures and costs for local police and EMS services. This emergency service can absorb visits from acute hospital emergency departments and reduce admissions, potentially saving more than $6 million a year. An additional $3.6 million can be saved through reduced length of stay, diversion from admission, indeed potentially diversion of 10,000 admissions to Ontario Shores. The total can amount to savings of more than $10 million a year. Also, this service could alleviate pressure on local emergency rooms, provide better, more specialized care for people experiencing mental health emergencies, and free up resources for other emergency services such as police and EMS. You may be wondering, how will we measure success of this model? We place a high value on measurement and evaluation at Ontario Shores, and we have some key performance indicators that we want you to know about. We want, on average, to have the wait time for EMS and police to be no more than 20 minutes. We want to reduce the admission rate from emergency services to 20% from the provincial average of 33%. We want stakeholder satisfaction on the part of patients and families and carers, to be 80% or greater. And finally, we're very committed to minimization and reduction of restraint and seclusion. And our key performance indicator is less than 1% of even the most emergent mental health situations would ever face restraint or isolation. As we consider the current health human resources challenges, I'd like to highlight that we've developed a comprehensive plan to ensure that we have the human resources to staff this model. We're a specialized mental health care organization with strong partnerships with local colleges and universities, and a current staffing complement that's highly engaged and eager to see this unit built. As a specialized mental health hospital, we're an ideal candidate and well-positioned to bring this concept to Canada. By committing to this project and advocating for it together, we have the opportunity to leave a legacy, the opportunity to transform the way emergent mental health services are delivered in Ontario. On behalf of the entire Ontario Shores staff and all of our current and future patients, we thank you. There's no better time to invest in mental health.
Up next is a Mental Health Minute, where Ontario Shores staff share insights, stories, and wisdom to inspire and uplift.
A memorable experience I had on Ontario Shores was when we were working with a potential participant for a research project. We were explaining the nature of the research. That was the purpose, the time commitment, and the incentives. And he was less excited about the incentives and what he might get out of the research. And he was most excited as, in his words, how the data he would contribute could affect and impact the patients with the same condition that he has in the future. So it was really nice to see how he was less interested in what this might give to him or what he might get out of it. And he was most excited to see how this could help people in the future, even if he wasn't around to see the impact of it.
So I got into the nursing profession just over 20 years ago. I had been working in group homes with individuals who were developmentally delayed. And one of the inpatients or in the group home had been admitted actually to Ontario Shores. And I came into Ontario Shores and I just watched the nurses and I was, I just fell in love at that point in time with mental health in general. And so I actually went into my nursing career knowing that I wanted to work in mental health. I think the proudest moment of my nursing career is when I see patients walking down the hallways and they stop and say, "Hey, Kathy, how's it going?" And we sit and have that conversation, because then I think back to the time when I saw that patient when they were at their very worst and where they were at their really, really sick and they were not doing well. And I was able to have that impact and help support them on their journeys. So when to this day, because I've been here for 20 years, I still see patients that I know how they were when they were really unwell. And now I see them better and know that I was able to help support them in that journey. What I've discovered about nursing in the pandemic is that how resilient nurses are. This pandemic has been one of the hardest things that many of us have ever gone through. And just to see how resilient and how truly caring nurses are. I know that it really brought back why I went into nursing and why many of my colleagues went into nursing is how, to truly care for our patients and no matter what. And so I think both resilience and caring is something that I really noticed throughout the pandemic.
I chose the nursing profession partly out of strategy. I had already gone to college once prior, and this was the second career choice for me. So I wanted to make sure I went into a career that had some opportunities and it was diverse in what you could do. Just that way there was a lot of variation and what you could what role you could take on as a nurse, such as education or frontline, or what I'm doing now in practice as a clinical educator. Throughout my career, some of the changes that I've observed is really especially in mental health, is some of the inclusion of more of the medical-based nursing coming into this area or this field of nursing. So seeing more of like a hybrid nursing where it's not just mental health or just medical, but more of a combination. I've seen a lot more of that. And I think partly that's due to the aging population and more complex comorbidities that we see along with mental illness. What I have learned about nursing throughout the pandemic is it's definitely a profession that comes with a lot of challenges, and we don't always have the right answers right away. And what I mean is during my year as a vaccination coordinator throughout 2021, there was a lot of questions about COVID and the vaccine and the illness itself. And we had a lot of questions and not a lot of answers. And I think that makes people feel uneasy. But I took comfort in knowing that we had some of the most brightest and well-experienced individuals working in the infection control department that really helped to steer us in the right direction based on whatever evidence we had.
I have seen a lot of change in nursing since I started. Being that I've been to different organizations, I've seen where nursing have moved from being more of a customer service role to imparting knowledge and kind of sharing your experiences. So that's a big shift for me since I started. I have been able to do a good job with work-life balance. I love soccer, or football, some of you might know it as. So I was able to go home after work, watch the game, look at highlights. During the weekends, I'm able to go out, play recreationally. So that kind of balances out how I work and how I go home and enjoy myself. The proudest moment of my nursing career has to do with something that happened outside of me coming into work. I was here for a 12-hour day. Going home, I had a hard day. I'm gonna say that, I had a hard day. Going home, I parked in a parking lot and I saw an older adult coming down with a scooter. He bumped into the curb and he injured his foot. I was able to stay there with him, call the ambulance, and seeing that I already had a long day, to know that I had that much more to give, I stayed with him for about 45 minutes before the ambulance came and kind of walk him through what treatment might be like for what his injury was. So that was interesting for me. It was one of those proud moments you're like, yeah, I could do nursing in my day job and still be able to go out and impart some nursing skills out in the world.
I chose the nursing profession as it seemed like a really good alternative to what I was in prior. I was in policing before that. I think what really got me into it was two other people I went to school with for policing both chose nursing as well. So once I found out I wasn't a very good fit as a cop and I still wanted to help people, I figured I'd help them with nursing instead of arresting. Some of the proudest moments that I have as a nurse are choosing to become a nurse. There was a lot of barriers to picking this profession. I was drawn to it, but there still exists a lot of stigma for a male to kind of enter the profession itself. A lot of it's nonverbal kind of barriers to overcome, but they still exist and you become very aware of them when you're in the environment of it. Working as a nurse, one of my proudest moments is I've been collecting COVID swabs now for about 2 years and I haven't gotten COVID. To achieve work-life balance, it's a struggle. It's something that I kind of work with every single day. And it's why I'm a very big proponent of debriefing and peer support within our facility. The job here is very tough, and we see a lot of different aspects of people's lives that are quite often kept very private. And we take something away from that. So it's hard to sort of leave it all here. But to achieve it, it's almost like a physical effort to go out and say, no, I don't have my work hat on anymore. I'm at home. I've got my family hat on. I've got my personal time hat on. It's almost like a physical adjustment of me telling myself I'm in this mode right now instead of at work.
Started my journey at Ontario Shores in '97. It was a new unit that was being opened. It was a medium secure forensic unit, FRU. I had the opportunity to start on the ground floor. I was a new nurse, so new nurses and seasoned nurses came together to open this unit and welcome the first client that walked through. So that was a phenomenal experience. Getting the whole, I call it my work family. I developed a work family. The relationships were fantastic. And I did that for about 13 years. And then I decided, well, I'm going to spread my wings a little bit. And I ended up in a community program doing community nurses for our community ACT team. And I did that for several years. And I thought, you know what, I need to come home. So I came back to Ontario Shores about 3 years ago in the Homes for Special Care program. And then the opportunity came up to work with the Durham ACT team in the community, and that's where I am today. I became a nurse because I always wanted to be a nurse. I don't remember a time in my younger years or, as I was going through school where I didn't want to be a nurse. And one of my favorite people in the whole world was my Nana, and she was a nurse. And I just loved listening to her stories, and I just loved the respect that the community gave her. She was from they lived in a small community, and just just her presence in that community and her profession just made me to want to be a nurse that much more. I've always been a mental health nurse, so I've noticed the changes in terms of like the destigmatization of mental health through like the Bell Let's Talk, or even just the conversations that we have now. Even my daughter's 17, so when she was young, I started the conversation about mental illness, talked to her about mental illness. They're offering courses in schools, so I just think it's sort of evolved over my time where it's more talked about, I guess, spoken of. And just her being able to, for me being able to attend her Girl Guide sessions to talk about mental health and different mental health issues and what's offered in the community. So it's just, just being able to talk about it more, I think. One of my proudest moments is just my daughter has decided to take up nursing herself. So she's applied to universities. She always told me she never wanted to be a nurse like her mom, but I guess my love for nursing kind of rubbed off on her. So this is the avenue she's decided to explore. So.
Well, I think how I got into the nursing profession was an interesting story. I never thought about nursing. I don't have any family members that are nurses. And as part of my high school co-op program, I was randomly selected to just go be a nursing student at North York General Hospital. And in that co-op program, I fell in love with the profession. I really enjoyed it. The nurses were amazing. I loved interacting with the patients and engaging with them. And since then, I knew exactly what I wanted to do. I think there's been lots of changes for nurses throughout my career. I think it's really great to see nurses' roles continuing to elevate at different tables and decision-making processes to influence the system. But I think even for direct care nurses, seeing how technology is influencing the way nurses are practicing and engaging with patients and families, it's really creating more opportunities for nurses to have greater reach with patients and families and be able to have more efficiencies in the way that they do the work that they do. I've had an amazing journey at Ontario Shores, and I think that I've had the privilege of having lots of opportunities, starting off in professional practice as an educator, and then having the opportunity to be the director of professional practice and clinical information, and really being able to lead some of the work with the teams around our electronic medical record and advancing quality of care and practice. And then had the opportunity to become the VP for practice academics and chief nurse at Ontario Shores. And then most recently have transitioned into the interim clinical services role, where I'm really rediscovering clinical services with a new lens. What I've learned about nursing, and I would say probably a rediscovery about nursing during the pandemic for me, has been, in the busyness of day to day, especially in the pandemic, I'm really proud of nurses. And I have to actually put a plug in for all of our staff. I'm really proud of all of our staff, including the nurses, that have continued to really uphold this level of passion and commitment to the work that we do, to the service that we're providing to our patients. And, some days I feel like the pandemic world has been so chaotic, and I'm at awe that people continue to hold this level of commitment. And so really proud of nurses as well as all of our staff, because I think they've all equally demonstrated that for us during the pandemic.
Yeah, throughout my career, I've seen, especially in the specialized mental health setting, we've been implementing so many evidence-based practices and quality standards. And for nursing, this especially means that we've been able to deliver new interventions with our patients, including psychotherapy and family intervention therapy. I started at Ontario Shores as a clinical nurse specialist in the forensics program. Following that position, I moved into professional practice, where I worked as a clinical practice leader. I began working very closely also with our cluster and our clinical informatics team, and I became the coordinator for the professional practice and clinical informatics department before moving into the director of professional practice and health information. My proudest moment in nursing is actually relatively new into my career. So I was 2 years into my nursing career, and I worked in an acute care setting, and I was nominated by my peers for the Nursing Leadership Award that year. It really inspired me to think that I had a lot to offer, and it really just invigorated me to continue to pursue leadership in ways that I could impact the mental health space. There's nurses in various roles all throughout the organization, and we come here and we're nurses, but we're also people. One thing I really learned in the pandemic is we're all in different spaces at different times, and just being with each other, having that caring attitude and empathy, and working with each other wherever we're at that day.
Ontario Shores is committed to building a respectful community. This is definitely a place to belong. As someone who is relatively new to the organization, at every turn I found a helpful, supportive, friendly face. If you're considering a career or a volunteer opportunity, this is the place to be. It's a place to belong, it's a place to learn, to thrive, to grow, and to feel like you are making real change in mental health.
I joined Ontario Shores because I wanted my work to be meaningful and see the people that I'm serving every day. Through continuous learning opportunities, I've received my LEED Green Associate degree, which can help improve our carbon footprint and be environmental stewards.
One of the memorable experiences I've had here at Ontario Shores is when I was the recipient of the Karim Mamdani Family Continuing Education Award. I was finishing my undergraduate degree, and I brought my two girls with me to see me receive that award. It was important for me to set an example for them and to show how the organization gives back to their employees. Additionally, it was equally as important for my children to get to meet Karim after the ceremony was done, and I think equally important to them as they got ice cream to celebrate as well. So just a true testament as to who Ontario Shores is and how they like to support their own and include everyone in the process. So for me, that was very rewarding and something that I won't ever forget.
Hello there, this is Karim Mamdani, and I'm proud to introduce myself as the President and CEO of Ontario Shores Centre for Mental Health Sciences. Thank you so much for tuning into today's episode and for joining us in these important conversations about mental health. I just wanted to take a moment to express sincere appreciation to the incredible team at Ontario Shores for their exceptional work. Our team of compassionate and skilled clinicians and staff work tirelessly to provide life-saving treatment and unwavering support for our patients and their loved ones who are facing the challenging impacts of mental illness. At Ontario Shores, recovery is possible and there is hope. I invite you to visit ontarioshores.ca to learn more about our work. On our website, you can explore our career and volunteer opportunities, learn about our programs and services, and find out how you can make a difference through donations.